Hello, this is Nursing School. My name's is Patrick. Let's start together our lesson of today. We are still discussing on fundamental of nursing in the unit of nursing process. Third step of nursing process is planning. Planning, the third step of nursing process, the process of prioritizing nursing diagnoses and collaborative problems, identifying measurable goals or outcomes, selecting appropriate interventions, and documenting the plan of care. The nurse works in partnership with the patient and family. Elements of planning. 1. Establishing priorities. 2. Identifying or writing goals, expected outcomes, that determine the evaluative strategy. 3. Selecting appropriate nursing interventions. 4. Document the plan of nursing care. 5. Communicate the plan of nursing care. Setting priorities. Determine problems that require the most immediate attention first according to their severity and potential for causing more serious harm. Factors based on to assign priorities. 1. Virginia Henderson 14 Basic need. 2. Use Maslow's hierarchy of human needs, the main methods used frequently to establish priorities. Problems interfering with physiologic needs have priority over those affecting other levels of needs. The ranking can change as problems are resolved or new problems develop urgency of the health problem or emergency. Medical treatment plan. Factors based on to assign priorities are A. ABC approach, B. the airway, C. breathing, D. the circulation, E. a client's priorities, F. client's health values and beliefs. Nurse identified priorities based on the holistic assessment of the client and situation, and availability of time and resources. Establishing goals or outcomes. To establish goal it require different thing. 1. Goal are desired or expected outcome. 2. Nurse and client set goals for each nursing diagnosis. 3. Nurses may identify short-term goals, long-term goals, or both. Short-term goals, outcomes that are achievable in a few days or 1 week. Long-term goals, desirable outcomes that take weeks or months to accomplish for clients with chronic health problems. Guidelines for writing goal or outcome. One of the most important consideration in goal or outcome writing is to encourage the patient and family to be as involved in goal development as their abilities and interest permit. Each patient goal or outcome must have a subject, which is the patient, and a verb, which indicates the action. Guidelines for writing goal or outcome. Write goals and outcomes in terms of client's responses, not nurse activities. Begin each goal with the statement, client will. Be sure that desired outcomes are realistic for the client's capabilities, limitations, and design time span. Ensure that the goals are compatible with therapies, treatment, or of other professionals. Use terms that are measurable and observable. Avoid vague words. Make sure that the client considers goals important and value them. Make sure that each goal is derived from only one nursing diagnoses. Characteristics of a goal. It must be SMART, S, specific, M, measurable, A, achievable, R, realistic, T, time-bound, client-centered, reflecting what the client will accomplish, not the nurse. How to select suitable nursing intervention. Planning of measures that client and nurse will use to accomplish identified goals. When outcomes are set, for each outcome, nurse selects nursing interventions that will help achieve the goal or outcome. Nursing interventions are directed to eliminate etiologies. The nurse selects strategies based on the knowledge that certain nursing actions produce desired effects. Whatever interventions are planned, they must be safe, within the legal scope of nursing practice, and compatible with medical orders. Types of nursing intervention. Dependent nursing action. This include actions prescribed physician's orders. Independent nursing action, carrying out by nurse. Prescribed interventions written on the nursing plan of care as well as any other actions that nurses initiate without the direction of another health care professional. and that result from their assessment of patient needs. Interdependent nursing action, which performed jointly by nurses and other members of the healthcare team. Documenting the plan of care. The planned nursing intervention should be documented in the client's records. The plan is a permanent part of the record. Thank you for following nursing school. My name's is Patrick. Let's be together in next video.